Welcome back. Today we are going to see on the problems or side effects or adverse effect that will arise with the use of antimicrobial agent. So first let us see what they are. First one is toxicity. Two types of toxicity can arise. One is systemic toxicity and other one is local irritancy. Second is hypersensitivity reaction. Third one is drug resistance, in which natural resistance is there and acquired resistance is there. Fourth one is superinfection. Another name is also there, which is superinfection. Fifth one is nutritional deficiencies, and sixth one is masking of an infection. Let's see them one by one. First one is toxicity, which involves systemic and local irritancies. In toxicity, first let us see about the systemic toxicity. Systemic toxicity, multiple sites of our body will be affected. We know that almost all antimicrobial agents produce dose-related and predictable organ toxicities. Example, aminoglycoside. They cause 8th cranial nerve and kidney toxicity. Next one is tetracyclines. Tetracyclines will cause liver and kidney damage. Chloramphenicol. They cause bone marrow depression. And all these drugs are the ones that have lower therapeutic index. So what do you mean by this therapeutic index? This therapeutic index is a quantitative measurement of the relative safety of a drug, or we can say relative safety of the antimicrobial agent. So it is comparison of the amount of a drug that causes the therapeutic effect to the amount that causes toxicity. So a comparison is happening there between the therapeutic effect and between the amount of therapeutic effect caused and also to the amount that causes toxicity. So larger the TI or therapeutic index, safer the drug is. Next we can see polymyxin B, which causes neurological toxicity. Vancomycin, which causes hearing loss and kidney damage. Amphotericin B, which causes kidney, bone marrow and a neurological toxicity. So these ones, polymyxin B, vancomycin and amphotericin B are the antimicrobial agent which has very low therapeutic index, and because of which its use is highly restricted to conditions where no suitable alternative is available. Now let us see antimicrobial agents which have high therapeutic index or relatively safer drugs. They are penicillins, some cephalosporins and erythromycin. So the next one in toxicity is local irritancy. That is that irritation happens at the site of administration alone. They are gastric irritation, pain and abscess at the site of IM injection, then thrombophlebitis at the thrombophlebitis of the injected vein are the complications. So what is thrombophlebitis? Thrombophlebitis is the swelling or inflammation of a vein, a blood clot, that is thrombus in the vein causes this swelling. So that is what we call as thrombophlebitis. So practically all antimicrobial agents, especially erythromycin, tetracyclines, certain cephalosporins and chloramphenicol are irritants. Next adverse reaction. So the next one is hypersensitivity reaction. All antimicrobial agents are capable of causing this hypersensitivity reaction. These reactions are unpredictable and unrelated to dose. Reactions from rashes to anaphylactic shock can be produced. So the next adverse event is drug resistance. Drug resistance can be either natural resistance or acquired resistance. First let us see natural resistance. In natural resistance means the microbes naturally lack the metabolic process or the target site on which this particular drug should act. so they don't have it naturally. So we call it as a natural resistance. For example, gram-negative bacilli, it will be unaffected by penicillin G, as they don't have the target site in them for penicillin G to act. And this type of resistance does not pose a significant clinical problem. Second one is acquired resistance. So this acquired resistance is the development of resistance by an organism that was sensitive before due to the use of an AMA over a period of time. That is, the prolonged use of an AMA has caused resistance. Okay, so that is what we call as an acquired resistance. Example is Staphylococci coliform, and this acquired resistance can happen with any microbes and is a major clinical problem. However, development of resistance is dependent on the microorganism as well as the drug. The bacteria that are notorious for rapid acquisition of resistance are Staphylococci and coliform. Others like Streptococcus pyogenes and spirochetes have not developed significant resistance to penicillin, despite it is widespread used for over 50 years. Whereas gonococci quickly develop resistance to sulfonamides, but only slowly, and low-grade resistant to penicillin. And this resistance may be developed by mutation or a gene transfer. Next is superinfection or suprainfection. This refers to the appearance of a new infection as a result of the antimicrobial therapy. In our body, we have normal microbial flora, and this normal microbial flora helps the digestion of food, produces vitamin K, and restricts the growth of pathogenic microorganisms by producing a substance called a bacteriocins. So that's how our body is protected by the normal microbial flora. But the use of this most antimicrobial agent may cause some alterations in the normal microbial flora of the body, thereby causing super or suprainfection. So let's see some examples. Examples of drugs that causes superinfections. They are broad or extended spectrum antibiotics such as tetracyclines, chloramphenicol, and ampicillin. Next, let us see what are the measures we can take to minimize superinfections. First one is use of specific narrow spectrum antimicrobial agents whenever possible. And second one is do not use these antimicrobials to treat trivial, self-limiting or untreatable viral infections. And we should not unnecessarily prolong antimicrobial therapy. So these steps are taken to minimize the superinfection. So next adverse effect is nutritional deficiencies. We know that the intestinal flora synthesizes some of the B complex group of vitamins and vitamin K, which is utilized by man. But the prolonged use of antimicrobial agents alter this flora and thereby result in vitamin deficiencies. For example, neomycin causes morphological abnormalities in the intestinal mucosa, thereby malabsorption syndrome can occur. Next one is masking of an infection. It is the suppression of another infection which is contacted concurrently for less time by antimicrobial agent while using for primary infection, and later on this masked or suppressed infection causes severe damage to the host. For example, here gonorrhea is the primary infection and penicillin, single dose of penicillin is given to treat this gonorrhea or cure this gonorrhea. But the patient has concurrently contacted with the syphilis, And the syphilis infection is masked by the use of single dose of penicillin. And another example is the masking of tuberculosis by short course of streptomycin given for trivial respiratory infection. So this patient is having trivial respiratory infection and concurrently he is contacted with the tuberculosis. But the use of short course of streptomycin will mask this tuberculosis infection. So that's for the day. Thank you for watching. Meet you in the next class. Bye.